Hey guys, it's Dr. Emer in West Hollywood, and it's Friday. I feel very lucky, not for what happened to my patient, but that we've been treating my patient and getting a really good result. This is something that's really affected her self-esteem, something that we don't talk a lot about on the internet. Tattooing of the eyebrows, the lips, and the eyes is very popular lately, but what happens when that goes wrong? And my patient had some tattooing done of her eyebrows, and she was very unhappy with it. And you can see here, we've actually worked to almost get rid of all of it. And literally in a few treatments, almost all of the tattoo pigments has lifted. You can see some residual pigment that's now coming to the surface because I did some tattooing already, 2 passes using the Describe patch. But I'm going to show you guys what we do when this is the case is we use the Describe patch and then we go over the tattoo pigment a few times to lift it and break it apart so the body gets rid of that tattoo pigment. The concern we have when patients come in with this is that it can affect their hair follicles, but those grow back, and if they're really concerned about it in the future, we can always do a little bit, let's go to the other side, you can always do a little bit of transplantation. We use Latisse in the meantime, so we're putting a product on here called perfluorodecalan, and turn around, yeah, there we go. Perfluorodecalan to absorb the energy from the laser and the gases that are released when the laser energy hits this. But you can see the reactivity of the laser. Turn to the left a little bit, and you can see over here the pigmentation's lifting. This is a ruby laser because she has a very unique type of pigmentation here due to her skin tone. One more time. Perfect. So I want to just say to you guys, I'm going to show you here now what the after looks like. You could see a little bit of redness, a little bit of lifting of the pigments, nothing too aggressive. How is the pain?
It wasn't bad at all.
It's not bad at all. She just says topical. But the key here is that we're lifting the pigment, and in a few treatments it's significantly improved. What we should notice after the fact is a little bit of frosting, a little bit of darkening of that pigment, and then over the next, it takes you, what, about a week or two for healing, for that pigment to kind of lift, for the pigment kind of to disperse, and then we wait about 3 to 6 weeks, anywhere in between there, to do another treatment. Obviously, I want her to feel better more quickly, so we try and do those treatments more quickly. We combine that with topical therapies like growth factors, retinols, Latisse, etc., to help the pigment disappear more quickly and protect the hair. But overall, you know, a lot of people don't know what to do when it comes to this issue, whether it's tattoo of the brows, lips, or eyes not being what they like it to be, or that the hair is irregular or damaged. You really got to go to an expert in lasers when it comes to that. And here we've gotten a really, really good result. And because of that, she wanted really to open it up to everybody and give them the information out there, because when she was doing her research online, she didn't find much information of what she could do. And this is me showing you what we can do using unique devices like Pico or Q-switch lasers in combination with topical therapies to get a really good improvement. And what I'm so glad about is in a few treatments, it's really going to change her life. That's the goal. Bye, guys.